Well, let's spend just a bit more time on this, just because I think a lot of us are not using these tests as often, and so we may not be familiar. The smooth pursuits, saccades, that I think the third one, I forget what you mentioned, was those three. Would you walk us through what those are and how do you perform those?
Sure. So smooth pursuit is holding you can use your finger, I use a pen usually, in front of them, and then their head is staying still, and then they're tracking the object in front of them. You do horizontal and you also do vertical.
Got it.
You're looking to see, are they able to stay on the target and is it smooth, hence the name smooth pursuit? Or do they have what we call like a catch-up saccade, where their eyes kind of lose track and then have to jump back onto it? Which, with aging in the older population, they can develop a little bit of that, and it's not technically a problem.
Yeah.
But it also depends on how dramatic it is, and is it happening both ways or is it just one? So that's smooth pursuits. Saccades is two targets out in front. I've heard it being performed different ways. I usually have people go from pen to finger, and I just have them on their own accord. I just kind of bounce back and forth between the two targets with head staying still, and it's just their eyes darting back and forth.
And what are you looking for on that one, Will?
So you're looking for if they are able to smoothly transition from one to the other without overshooting or undershooting the target.
Got it. Okay.
I've seen some people perform it where they tell someone, look at my pen, now my nose, now the finger, now my nose, and they kind of vary it. I've seen mixed ways on how to do that, and maybe that's the more preferred way, but I don't always do that way.
Okay, fair enough. Was there a third one?
Yeah, the other one, VOR cancellation. So first I'll mention that VOR is the vestibular ocular reflex. So it's your body's ability to stabilize your gaze on an object while your head is in motion.
Got it.
I think a lot of people might be familiar with this one, at least like the performance of it, where someone looks at a target and then they're turning their head back and forth, and then they're trying to maintain their gaze on that target. And they should be able to do it without getting dizzy, for one. Yeah. And then you should see that their eyes stay fixated on that target while they're performing the head motion.
Got it.
That's VOR times 1.
Okay.
So VOR cancellation is when someone is looking at a target in front of them, and they are turning essentially like their head or body needs to be moving in space while they're tracking a target. And it's a test for the cerebellum. So the cerebellum essentially cancels out the VOR reflex so that they can keep their eyes on the target, because the head and the target are moving in unison.
Gotcha.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.